Okay, so you're standing there, maybe with your morning coffee, maybe getting ready for bed, holding your blood pressure pills,
Hmm.
and you think, is there actually a best time, a magic hour to take this for, maximum effect? It's such a common thought.
It really is. And you see so much chatter about it online, sometimes conflicting stuff. It feels like it should be simple.
Exactly.
What we're doing today is trying to cut through some of that noise. We've gone through a whole lot of the research, the official guidelines,
Mm,
to basically pull out what really matters for managing blood pressure well.
right. Our mission then is to get to the heart of this timing question, give you the solid info you need without, making your head spin, and maybe show why sticking to a time is often more important than which time. So let's start with the big question. You'd kind of expect, wouldn't you, that massive studies would point to one specific time, like 8 a.m. is best or something.
You would think so. It makes intuitive sense. But here's where it gets really interesting. When you look at the really big, well-designed studies, they just don't show a clear winner between morning and bedtime dosing for most people.
No clear winner. Seriously.
Yeah, pretty much. Now, there were some smaller studies, and you might have heard about these, that hinted maybe bedtime dosing could slightly lower risks like heart attack or stroke.
Uh-huh. I think I remember reading something like that.
Right. But the crucial thing is the larger, more definitive research hasn't backed that up consistently. So the big picture takeaway from the science right now is that overall, both morning and evening seem safe and effective for controlling blood pressure and preventing major heart issues.
Wow. Okay. So that kind of flips the script on the common assumption, doesn't it?
It does, for many people. It suggests the focus might need to shift a bit.
So if the research isn't giving us a universal best time, what do, the doctors' groups and the official health guidelines actually recommend? Where do they land on this?
Well, they generally follow the evidence. Most expert guidelines, they don't specify one ideal time for everybody.
Okay.
Their main emphasis, almost across the board, is on consistency. Taking your medication reliably every single day. Finding a time that just fits into your life so you don't forget, that's paramount.
Just making it a habit.
Exactly. Adherence is key. Now, there is an important but here.
Oh, okay.
For some people, their blood pressure doesn't dip normally at night. It stays high. That's called nocturnal hypertension. In those specific cases, a doctor might suggest trying certain meds in the evening to target that nighttime pressure.
Got it. But that's a doctor's call, based on monitoring, not something you just decide on your own.
Absolutely. It needs a proper assessment and a discussion with your healthcare provider.
Okay, so consistency is king for most of us. But what about the type of medication? Does that ever change the timing advice? Like, does it matter if it's a water pill versus something else?
Yes, it definitely can. That's a really practical point.
Huh.
The type of drug matters. So diuretics, often called water pills, they're a classic example.
Right.
Doctors usually recommend taking those in the morning. And the reason isn't really about blood pressure peaks. It's simpler.
Okay.
It's to avoid having you wake up multiple times overnight needing the bathroom, which, ruins your sleep.
Haha. Yes, that makes total sense. Very practical.
Exactly. Then you've got other common types like ACE inhibitors and ARBs. These help relax blood vessels. For those, generally, morning or night is fine. It's flexible.
Yeah.
But as we mentioned, if that nighttime pressure is an issue, sometimes a doctor will try a bedtime dose.
Okay, still flexible, but with that potential nighttime adjustment.
Correct.
Mm.
And then things like calcium channel blockers and beta blockers,
Mm.
they're also usually pretty flexible.
Huh.
Take them whenever it's most convenient for you, morning or evening, whatever helps you remember.
So quite a bit of flexibility there, too.
Mhm. And if you happen to be on a combination pill, one that has, say, a diuretic plus another type of drug,
Yeah.
you'd usually follow the advice for the main component, especially if that component is a diuretic. So likely morning for that one.
This is super helpful getting specific like that. Okay, so putting this all together, how do you, listening right now, figure out your personal best strategy?
Right. How do you make this work for you? The number one thing is pick the time of day you're genuinely most likely to remember. Full stop.
Make it easy on yourself.
Precisely. Is it with breakfast? After brushing your teeth at night? With another daily med? Link it to something you already do. Consistency trumps perfection here.
Good advice.
Second, and this is critical, don't just switch your timing around on your own, especially if you're having side effects like dizziness or, the bathroom issue with diuretics. Talk to your doctor or pharmacist first.
Always check first.
Always. And third, going back to that nighttime thing, if your doctor specifically suspects your blood pressure isn't dipping enough overnight, they might recommend a change in timing after checking things out. follow their specific guidance.
Makes
Because remember, the ultimate goal isn't just hitting a target number when you check it once a day. It's about smooth, controlled blood pressure over the full 24 hours. That's what protects your organs long term.
That's a really key point. Not just the snapshot reading, but the whole day and night. So after all this, it feels like the big takeaway isn't some secret optimal minute on the clock. It's more about finding your reliable minute, right?
That's it, exactly. Find your time, stick to it consistently, and understand if your specific type of medication has practical timing needs, like diuretics in the morning.
So bottom line for you listening, taking your blood pressure medication regularly, consistently, that's usually more important than the exact hour. Morning or evening dosing. Both generally work well for most meds.
Precisely. And maybe the provocative thought here is this. While the best time often boils down to your routine and your doctor's advice, really thinking about how that consistent 24-hour control protects your long-term health beyond just one reading, that's the deeper goal for your well-being. And always, always talk with your physician or healthcare provider if you have any questions or concerns about the timing, the side effects, or anything else about your treatment.
Couldn't agree more. And just our usual reminder, this deep dive is for informational purposes. It is absolutely not a substitute for medical advice from your own provider. Always follow their instructions for your specific situation.